Hello, my name is Aksa Iqbal, and I'm a second year internal medicine resident at Northeast Georgia Medical Center. I would like to present an interesting case involving a unique presentation to third cranial nerve. The third cranial nerve is responsible for several functions involving eye movement, but also innervates the pupil, lens, and eyelid. Therefore, when this nerve does not function, there can be partial or complete ptosis, anisocoria, or eyelid drooping. Multiple etiologies can lead to third cranial nerve palsy, with common etiologies include infarction, hemorrhage, trauma, tumor, and inflammation. This case report aims to highlight the diagnostic progression undertaken to identify the cause of a third cranial nerve palsy, as well as provide additional data to the body of knowledge for this rare disorder. In regards to the case presentation, a 63 years old female with no significant past medical or surgical history was visiting the United States from Mexico when she suddenly developed a headache. She described the headache as located in the left frontal portion of head and was a sharp sensation. Provoking factors include pressing and closing ipsilateral eye and with no real palliating factors. Of note, patient denies any ophthalmological or neurological history. Physical exam revealed left-sided partial ptosis with left pupil dilation and internuclear ophthalmoplegia. Review of lab values showed elevated ESR and CRP. ANA was negative. Given the neurological findings, lumbar puncture was done, showing a slightly elevated WBC of 11, but cultures were unremarkable. MRI of brain with emphasis to orbit region was done and showed enhancement to left cavernous sinus, specifically inflammation noted along the nerve sheath. Based on all the data obtained, it was determined patient had Tolosa-Hunt syndrome. Patient was started on high-dose steroids and showed improvement in symptoms on day of discharge. Follow-up approximately 1 month later showed continued improvement in her symptoms. Little bit about Tolosa-Hunt syndrome. Tolosa-Hunt syndrome is a rare disorder with 1 case per million per year. Typically will affect patient from 1st to 8th decade of life. This disorder is typically considered a diagnosis of exclusion. Therefore, other causes for inflammation should be ruled out. MRI is important diagnostically in determining area that is affected. High-dose steroid with a prolonged taper is currently the method of treatment for these individuals. This case aims to increase awareness of this disorder so that it should be considered when patient present with third cranial nerve palsy. This case report also highlights a diagnostic approach for the workup of a third cranial nerve palsy. Thank you for your time to listen to this presentation.